Well, Illinois Cancer Care collaborated on a national clinical trial resulting in exciting findings for some patients who are diagnosed with a specific type of brain tumor. Joining us with more today are Dr. Francois Geoffroy and Jamie Harper, Director of Clinical Research. Thank you both so much for joining us today.
Thanks for having us.
So, Doctor, I guess first of all, if you could tell us a little bit more about the specific trial and the type of brain tumor that it was examining.
So the trial focused on what is called a WHO grade 2 low-grade tumor, which would include an oligodendroglioma grade 2, an astrocytoma grade 2, and what's referred to as a mixed tumor, which is a grade 2 oligoastrocytoma. This represents 10 to 15% of malignant brain tumors, or roughly 2,000 to 3,000 cases per year. And they focused on the higher risk patients. And the higher risk patients were defined very simply, age over 40, or those patients who did not have more than a 90% removal of the actual tumor. And they were registered. The patients following the surgery all had radiation, the same type. Half received chemotherapy, which took roughly 48 weeks of their time, and the other half did not. And the report, after a median follow-up of 12 years, states that the people who received the chemotherapy had a 5.5-year survival benefit versus the patients who received the radiation alone.
So I guess in layman's terms, what does that really show us about the treatment options for this specific type of tumor?
Well, historically, for the grade 2s, the role of chemotherapy was not known. We knew that radiation had a positive impact on slowing the growth of the gliomas, but it did not impact survival in a positive fashion. So this is really the first time we have shown that we seem to be able to positively impact the survival of these patients.
So in turn, prolonging their quality of life as well?
Prolonging their quality of life and their overall survival as well.
Okay.
We are, however, awaiting some molecular characteristics. These are not out yet, but I think that will further help define which patients benefit the most.
Now, Jamie, in terms of Illinois Cancer Care's role in this study, can you tell us a little bit more about that?
Sure. Low-grade gliomas are relatively uncommon. So we only may see a handful of these patients, but being able to be a part of a large national research network allows each one of our sites to see a handful of patients, but collectively see hundreds. So the patients here in Peoria are helping patients all throughout the nation with this disease.
And you mentioned it is uncommon. So in terms of the few patients who may be local, who may benefit from this trial, what does this mean in terms of their cancer care outlook?
The patients who enrolled in this trial enrolled in 1998 through 2000. So it takes a long time sometimes to get these results out. So the patients, when they enrolled, they're seeing benefits to themselves because they're getting enrolled to the standard treatment plus additional treatment, which we found to have extended their lives almost by 6 years. And so they're getting benefit themselves, and then they're also helping patients almost 20 years today receive that treatment and being allowed 6 more years of time with their family and friends.
Definitely a positive outlook for those people indeed. Well, we thank you both so much for bringing it to our attention and for the exciting possibilities that Peoria was able to take part in. Thank you both for joining us today.
Thank you.
Well, up next, you've heard the rumors. Now we're chasing down